The team of psychiatrists from the Northwell Health facility in the United States will travel to Mahdia in Region 8 to provide immediate support to those affected by the deadly fire at the school dorm. The doctors and residents from Northwell Health adds to the mental health team comprising stakeholders from various government ministries and agencies who were mobilized to provide support. During an interview with the newsroom on Wednesday, Dr. Meyer Bellison, one of the 4 foreign doctors, said it was evident that a team should come to Guyana to conduct first-hand evaluations of the survivors and the community at large, given the severity of the situation.
So our team came down to provide some additional support as well as understand what's happening on the ground and work together with the administration and government on thinking about the long-term response and guiding policy and development of resources to be able to provide support over time.
The tragedy struck on May 21st at about 2300 hours, and 20 children, 19 girls and a 5-year-old boy perished in the fire. The school houses girls from Mahdia, Campbelltown, Mycobie, El Paso, and several other villages in the North Pacaramas in Region 8, Putara Superuni. These are all close-knit villages, and according to President Dr. Irfan Ali, the main priority for the government is to provide the support they need at this time. He has said no effort will be spared during this difficult path. Dr. Bellison, a clinical psychiatrist, explained that individuals must have the necessary resources to cope in the aftermath of these kind of stressors. Hence, the general response for traumatic events is to identify the needs, find any practical support to meet those needs, and help people to feel a sense of safety.
They are on the ground in Mahdia supporting the kinds of larger community gatherings that are happening, where information is being shared, typical ways of responses or reactions and coping is being offered, and also the avenues or the resources that are available for more individualized support.
Already, a critically ill girl, 13, who was receiving treatment at the city hospital, was medically evacuated to Northwell Health Burns Center for much-needed treatment. Meanwhile, Dr. Tristan Griffith, a psychiatrist attached to the GPHC psychiatry unit, reminded that the response to the fire by all sectors was immediate. Notably, he said the group of healthcare providers may be the longest-staying group.
We've had teams to review and to help manage the patients that were admitted. We've also dispatched teams to the hotels that the families were staying. We've had sessions with the family members. So we've been pretty much involved in every single step of the management of the patients and their families and providing that support that is needed. The initial response is to provide psychological first aid for persons because everybody responds differently to trauma and stress.
He explained that the team is still providing psychological first aid and identifying individuals who may be showing more exaggerated responses while making specific interventions and coping strategies. Personnel from the Ministry of Health's Mental Health Unit, the Georgetown Hospital's Psychiatry and Psychology Unit, and the Child Care and Protection Agency are also part of the team. Reporting for the newsroom, I am Lazina Yearwood.